Welcome back to another edition of the Hart2Heart Podcast. And today I'm going to be doing another solo episode. So this episode is going to be on Ozempic and GLP-1 agonists. So I'm sure you've heard of Ozempic now. A lot of people are using it for diabetes, but they're also using it for weight loss. There's a lot of controversy over this. Is this medication safe? Is it effective? What happens when you come off of it? I'm going to be going over all these things today. All right, so we know that a lot of people are using this. And we know that some people have used it successfully, but unfortunately, a lot of people have used it unsuccessfully as well. So let's just get right into it, okay? So first of all, what are GLP-1 agonists like Ozempic? So Ozempic is also known as semaglutide, and it's a peptide. So it's a peptide just like BPC 157 or TB 500 or any of these other peptides that you hear a lot of people talk about, such as Joe Rogan or Andrew Huberman, or a lot of these people today are talking about peptides and how they can influence health and improve health. The ones I just mentioned, BPC 157 and TB 500, those are more used for healing injuries. TB 500 does have a little bit of a performance enhancing effect as well, but primarily they're used for healing injuries. So the primary reason that we're using GLP-1 agonists originally was to help with diabetics, but also, like I just said, it's also used for weight loss as well. So, what exactly is a GLP-1 agonist and what is GLP-1? So GLP-1 is glucagon-like peptide. So this is a hormone that we actually have in our stomach, and it gets released in the when we are eating, or after we eat. And so once we eat, this peptide then comes in and it sends a signal to our brain that we're full. It also slows gastric emptying, which again signals to us that we're feeling more full. And because of this, that's one of the reasons why people are using it for weight loss and why it's so effective, is because people feel full. They have reduced appetite. They don't feel like they need to eat. So overall, they're consuming less calories. When you consume less calories overall, you're likely to be more in a caloric deficit and you're likely to lose weight. So what are the other functions of this GLP-1 agonist though, like semaglutide or Ozempic? So the other thing that they do is they can enhance insulin release. So we know that when we enhance insulin release, it reduces blood sugar from the bloodstream. So that's why it can be so effective for diabetics. It's been shown to improve what's known as their hemoglobin A1C, or anyone's hemoglobin A1C. So hemoglobin A1C is your measurement of your blood sugar over 3 months. So when they originally designed Ozempic or semaglutide, that's what they were using it for, was for diabetes because of its effect on insulin. And in addition to its effect on insulin, it also can have other functions, like I said, such as reducing appetite. And by reducing appetite, people again are just consuming less calories overall. So a few different effects that it has will lead to lower blood sugar levels. And the other thing that's kind of interesting about this molecule as well, again, this is very, very speculative, but it seems to have potentially some neuroprotective effects. Again, it's not prescribed for that. We don't have too much data on it, but there is some preliminary evidence that shows that GLP-1 agonists like Ozempic or semaglutide can in fact have neuroprotective properties. It could reduce incidence of, say, mild cognitive impairment, dementia, Alzheimer's, any of these kind of neurodegenerative diseases that we encounter as we age. So in terms of GLP-1 agonists, the one that most people are familiar with, again, is Ozempic or semaglutide. There are other forms of GLP-1 agonists though. Wegovy is another medicine that is also used for weight loss specifically. Now, that is also semaglutide. So even though you are getting what's called, essentially a different brand name product, you are getting the exact same molecule. So, why would they do that? So generally when people get Ozempic, which is approved for diabetics only. It's not specifically approved for weight loss. People generally gravitate towards that one because the dosages that we tend to use are lower. People tend to start off with 0.25 milligrams per week, and then they increase that up to 1 milligram, generally for diabetics. And that may be done over weeks to months, generally, obviously, under the care of a physician, or always under the care of a physician, I should say. So that would be the way that semaglutide or Ozempic works for diabetes. Now, regarding Wegovy, again, it's the exact same molecule. It's semaglutide, but people generally just use a higher dose. And when you get a higher dose, you just get more pronounced effects. When you get more pronounced effects, you're going to get more of the effects that we just discussed with regard to GLP-1 agonists. So, more of the enhanced insulin secretion, more of the decreasing of the gastric emptying. So all these things are going to be enhanced with a higher dose. Obviously, with a higher dose, though, you are more likely to get side effects. And I am going to get into side effects in this podcast in a little bit as well. But before we go into that, I just want to give just want to round out all the ways that we can use semaglutide. So we've talked about Ozempic, which is currently right now only approved for diabetes, but obviously does have some effect on weight loss, or a massive effect on weight loss. Then we have Wegovy, which is approved for weight loss. And we know that Wegovy is the same thing as Ozempic. They're both semaglutide. They just use it at a higher dose. So again, Ozempic is only approved for up to 1 milligram, but the Wegovy is approved for 2.4 milligrams. So, you're almost getting 2.5 times the dose at the max dose at Wegovy compared to Ozempic. And that may be the reason why some people get better results. Again, same molecule, just using a higher dose. Now, in terms of the oral medications that you can use with regards to semaglutide, there is one available. It's called Rybelsus. So again, this is taken orally. People start off again with a low dose, and then they increase the dose just like they do, say, with Ozempic. And so why would you want to use, say, something orally as opposed to, say, an injectable? Well, some people just don't like injecting themselves. That's really the bottom line. Some people just prefer to take a pill as opposed to put a needle into their stomach, for a variety of different reasons. But some people are just scared of needles. When you're taking it orally, you will have to take a higher concentration. Like people are taking 3 milligrams starting off, even 7 milligrams later as a maintenance dose, and it can go even higher than that, again, under physician supervision. So there are oral forms of this particular diabetic or weight loss drug available. But the key with taking it orally, and this also applies to taking it subcutaneously as well, is that generally you want to do this on an empty stomach. There'll be a little bit of a less of an effect when you are taking it through an injection versus when you're taking it orally, meaning that when you take it orally, then you are going to really need to be on an empty stomach, because if you're taking it with food, it's not going to absorb properly. You're not going to get the desired effects that you're looking for. So if you do decide to go with the oral route of this medication, and again, I'm not pushing this medication on anyone. I'm just doing a podcast and giving you guys the information, and you guys decide what you want to do with it afterwards. Again, under the care of your physician, but I just want to give you all the education on it. So the Rybelsus is an oral semaglutide option that is available, and some people do prefer that option due to the fact that they don't have to inject themselves. And so you will see the exact same thing again, with the oral form as opposed to the injection form. You're just going to get potentially less pronounced effects overall, just because it is fairly poorly absorbed orally versus subcutaneously, which is generally how it's injected. So, let's talk a little bit about the other aspects of the beneficial aspects of GLP-1 agonists. So, one of the big things that people have shown or that studies have shown in clinical trials is that it can actually reduce cardiovascular risk. So people who go on these drugs do tend to have less cardiovascular events. And this is likely due to the fact that they're managing their blood sugar better and they're also losing weight. So we know that having high blood sugar or high hemoglobin A1C is a major risk factor for aging, a major risk factor for cardiovascular disease. And so anything that reduces that will reduce your risk of cardiovascular disease. In addition to that, the weight loss aspect obviously is huge. We know that waist circumference, like I just mentioned, is highly linked to metabolic disease, cardiovascular disease. And when you use this medicine, you may in fact be able to reduce your overall risk of cardiovascular disease, of metabolic disease. So, like I said, in addition to the diabetic use and in addition to the weight loss use, there are some protective effects, particularly with metabolic and cardiovascular disease. And again, this is more or less just relates to two big things, and that would be the weight loss causing reduce in your waist circumference, and then also a reduction in your hemoglobin A1C, which improves your overall blood sugar level. So, when would you want to use Wegovy, and, when is it actually approved? So again, this is the higher dose version of semaglutide or Ozempic, and it's generally approved with people, or it's generally approved or FDA approved for people who have a BMI over 30 or a BMI over 27 and also have other risk factors, say like hypertension or obesity. So these things can be prescribed when you do have a BMI that's elevated, and also when your BMI is slightly elevated at 27 with other cardiovascular risk factors. And what do the trials show for Wegovy? They do show that people do tend to lose about 10 to 15% of their body weight when they use this medicine. Now, is that going to stay off? I'm going to get into that a little bit later in this episode and talk to you about, side effects and what happens when you come off of it. But for right now, I just wanted to mention that it does have, a high, the studies do indicate that it does have, that it can, in fact, reduce overall body weight fairly drastically, like I said, by about 10 to 15%. So obviously, we've kind of talked about a little bit of the benefits now, but people want to know the risks. I'm losing weight, I'm doing better, hemoglobin A1C is coming down, but, are there any risks of this? And unfortunately, yes, there's no kind of biological free lunch, as most people like to say. And Ozempic or GLP-1 agonists are no different. And so most of the side effects are going to be in the gut. So because again, that's where the drug works. So that's where you would expect to have some of those negative side effects. So a lot of people get nauseated. A lot of people have abdominal pain. They get diarrhea. All these things can happen. They do tend to happen initially when you're using the medicine. So, if you're going to use this medicine, definitely start off using a low dose, because if you use a higher dose, then you're much, much more likely to get these side effects. So, start off on a low dose. Like I said, for Ozempic, a lot of people start with 0.25. If you want to minimize it even further, and you can use like 0.125 and see how that goes. I know there are people out there who are using a minimal amount of semaglutide and are getting really good results with it. And so, that is something or an option that you could use to help overall with weight loss and with using this particular drug. So in addition to side effects that can happen in the abdomen, there are some other serious side effects that we do need to discuss. One of them is pancreatitis, so inflammation of the pancreas. It can be very, very, very painful, fairly difficult to treat as well. And so, if you are someone who's had episodes of pancreatitis in the past, chat with your doctor before you use this drug, because, I don't know if that could potentially induce an episode of pancreatitis and, obviously make everything worse for you. You want to use this drug properly. You don't want to risk yourself. And so if you do have pancreatitis, you've had, an episode of pancreatitis before, chat with your doctor, tell them about that, because if you don't, you could be putting yourself at risk. What are some other, very, very serious risks associated with this? So right now there is this thyroid risk. Okay, so we're not sure if it could cause thyroid cancer, which is obviously very, very scary. And again, I'm not saying that it's zero risk, but it is low risk, and I do want to mention it. Most of the data on this has been shown in animal studies. It hasn't been shown in humans yet, but still, I think that we should be very, very cautious about using this medicine in people who may be susceptible to thyroid cancer, have a family history of thyroid cancer, any of these types of things, because like I said, it has been shown to, induce thyroid cancer in animal studies. We can't really confirm that right now in humans, but, we could see a study later on coming out showing that yes, indeed, Ozempic or GLP-1 agonists can in fact increase the risk of thyroid cancer. So I really want people to, be aware of that one, because again, the consequences obviously are so damaging. You know, these risks, like I said, the best way to minimize them is definitely to start off with a low dose. Are there other things that you can do to minimize the risks? Yes. So what are they? You can just eat very small, low-fat meals. By eating small, low-fat meals, you will reduce your risk of the side effects from this medicine, and that may potentially help you stay on this medicine so you can get the benefits of it and carry on with your weight loss or lowering your hemoglobin A1C or cardiovascular risk or whatever it is that you're really, really looking for. Now, in addition to the side effects that I've mentioned there, there's also other things that some people are concerned about, and this is really relates to body composition. And so people are afraid that by using this drug, they may in fact be losing muscle instead of fat tissue. And so I can tell you that with any diet or with any time you're in a caloric deficit, if you're not eating a lot of protein, if your hormones aren't optimized, you are going to lose a ton of muscle mass. So, whether you're using Ozempic, whether you're just, putting yourself on a low calorie diet or reducing your overall calories, whenever you do that, you really want to make sure that you're strength training, that you're optimizing your hormones, and that overall you're eating a ton of protein. So about 1 gram of protein per pound of body weight. That's really going to minimize all the muscle mass that you may lose from using this drug. Because again, anytime you put yourself in a caloric deficit, you are at risk of losing muscle mass. So how can you minimize that risk of losing muscle mass, whether it's using Ozempic or whether it's through a caloric deficit? Again, it's 3 major things. So it's strength training, we have protein, and mostly hormones like testosterone and growth hormone. Okay, when these things are optimized, your risk of losing muscle mass is going to be vastly, vastly, vastly minimized. Okay, so for some people, if they lose 10 pounds, they might lose 5 pounds of muscle and 5 pounds of fat, which is not very good. But if you're doing all the things, like I said, strength training, protein, optimizing your hormones, you're likely to lose, say, more like 8 to 9 pounds of fat, maybe 1 to 2 pounds of muscle. And some people may even be really lucky and not even lose any muscle at all. So, definitely want to employ these strategies, whether you're in a caloric deficit or whether you're using Ozempic. Make sure that you definitely use these strategies, because if you don't, you will be at risk for losing muscle. We know that losing muscle can lead to a lot of different things, especially for old people. It leads to frailty, leads to falls. And so, definitely want to make sure that you minimize any type of muscle loss that you possibly can. Now, in addition to losing muscle mass, some people have what's called the Ozempic Face. And I want to address this because it has come up in social media and through different platforms. And people are, saying that people are losing weight basically, too fast, and they're, getting kind of like these saggy faces that sort of look, just a little bit awkward. And so, what I would say is that, lose weight slowly. Okay. So, I think any more than 2 pounds a week, it may be a little bit too aggressive. Okay. So if you're losing more than that, again, you may be losing a little bit of muscle. You may be losing some of the tone in your face. And because of that, you can get what people called Ozempic face. And again, really all you need to do to, minimize your risk of getting Ozempic face is to make sure that you're not losing weight too fast. Okay. So don't go on a crazy high dose right away. And if your dose is, if at 0.25 milligrams of semaglutide, you're losing weight at 2 pounds a week, I wouldn't increase the dose, because you don't need to lose weight any faster. Just 2 pounds a week is great. Just keep going at that rate. You don't need to lose weight any faster. You're just going to be putting yourself at risk for losing muscle. So those are my thoughts on, Ozempic face and what to do. In terms of, what happens to people's mental state when they're eating this, and I think this is, one of the more important parts of this discussion today. So a lot of people have struggled losing weight, and we know that the main reason that people struggle with losing weight is due to overeating. Now, obviously, it's due to inactivity as well, but overall, it's mostly due to overeating. It's a lot easier to overeat than it is to get on the treadmill and burn calories, right? So it's just so much easier to overeat. So because of that, what we want to do is we want to make sure that people are aware of what happens when you are on this medicine and when you're off this medicine. So when you're on this medicine, it will reduce your appetite, like I said, which will lead to a caloric deficit, which will lead to weight loss. So what happens when you stop taking this medicine? Unfortunately, when you stop taking this medicine, all of the cravings that you had before will come back. Now, this is obviously not a good thing. And a lot of people, what happens is they go on Ozempic, they lose weight, they come off, they put it all back on. And for that reason, some people say that, if you are losing weight on it and you come off of it and you can't, keep it off, you should go back on Ozempic, which basically makes you a patient for life. Okay. I'm not going to make too many comments on the pharmaceutical industry. I'm sure they would like, people to be patients for life. Obviously, it's going to make them more money. It's going to make them much, much more successful. It's going to make the drug more successful. But a lot of people, may not want to use a drug that way. They may just want to use it as a kickstart, something to kind of just like help them along the way. And so if you're one of those people who's thinking, what, I just want to use this for short term just to kind of lose a little bit of weight and then I want to get back to, where I'm going, that's okay. All right. But I'm just letting you know that when you stop taking this medicine, all the cravings are going to come back, okay? Because you're not going to have that GLP-1 agonist, performing all those functions in your body anymore. You're not going to have the insulin secretion lowering your blood sugar. You're not going to have the slowing of the gastric emptying that makes you feel full. The signal that goes to your brain that tells you that you're full. None of that's going to happen. And so because of that, you may start to overeat again. And so, I do want people to be aware of that. I've seen patients that have done this before and say, well, it definitely does happen. So how do you get around that? Well, it's not too tricky, and it is very tricky, and it's going to be something that you have to be very, very conscious of. So just get a sense of, before you take this medicine, of your triggers, why you eat a certain way, overall your dietary patterns, making a food journal usually makes a big, big difference. But you really want to just be, conscious and mindful and aware of how you're eating and why you're eating. And if you do that, and then you take the Ozempic, and then you notice, okay, when I take this Ozempic, I feel more full. I'm not craving things as much, and therefore I'm able to lose weight. Now, when I stop taking the Ozempic, then at that point, you need to become hyper aware of your cravings. You need to understand that any time that you reduce your dose, these cravings are going to come back. And when these cravings are going to come back and you don't have that in your body, you are going to have to rely on willpower in order to reduce your cravings and to continue with the weight loss. Obviously, that's a lot easier said than done. And I'm not saying again that you should be on the medicine forever. Again, that's not my call. That's between you and your doctor. But what I am saying is that these things will happen. You are going to get hungry again. You are going to have these cravings again. So what you need to do is be mindful of this and to just use willpower. You have to understand that you did it once with medicine and now you're going to be doing it without medicine. And the way to do that is to slowly reduce your dose. Okay, so don't go from 1 milligram to half a milligram, or even from 1 milligram a week to 0.75 a week. Just go down very slowly and very incrementally. Okay, if you go from say 1 to say 0.9 or 0.95, you're less likely to notice those cravings when they come back, but you are also more likely to have less severe cravings, and you could potentially have the willpower to help you with that craving. Meaning that, say if you went from 1 milligram to 0.5 milligrams, that may be too much for your willpower to overcome. So you get back into these bad habits right away. But if you go, say, from 1 milligram to 0.95 milligrams or to 0.9 milligrams, then your overall appetite is going to come back very slowly. And through mindfulness and through willpower, you may be able to adjust to those cravings coming back and then get back into a rhythm where now you're able to control your cravings, you're able to be more mindful, you're able to understand what triggers your cravings, what's happening to your body, how you're responding, how your mind is thinking about this, and you're able to make better choices. And so if you are going to use this drug, that's the way that I would do it, and that's the way that I would come off of it. Okay, I would be very mindful this whole time. Oh wow, this is making me not eat a lot less. I need to make sure that I can still have these habits once I don't have this drug in my system. And again, that's going to have to be done through you, not through the drug. You're going to have to be mindful. You're going to have to be aware. You're going to have to be vigilant, and you're going to have to use some willpower. Okay, it will have some difficulty, but like I said, if you do it slowly, say you go from 1 milligram to 0.95 milligrams, then that's going to help achieve success overall through transitioning from Ozempic or any kind of GLP-1 agonist to not using it at all, and hopefully achieving the same results. So that's the way that I would try to use Ozempic if you're someone who just wants to start it and then eventually stop it, once you lose the weight that you've achieved. So, moving on to other topics regarding GLP-1 agonists, one of the things that comes up a lot is the cost. The cost of these can be astronomical. So, it can be $900 to about $1,300 a month for these drugs in the United States. And so this puts a huge barrier for a lot of people on this type of medicine. And why am I bringing this up? Because, costs come up a lot in medicine, and sometimes we don't talk about them. And people just need to be aware of the cost before they even start a medicine, because, maybe it's something that you want to try, but if you're not able to afford it, unfortunately, then, it's good for people to know this firsthand, as opposed to just being told the cost after they've done all the research, after they've done everything that they've decided that they want to do it, and they find out that they can't afford it. So I did want to bring that up, particularly for that reason. So the other peptide that I want to talk about today is Tirzepatide, or Mounjaro. So you may have heard of this before, and you may have heard that it's actually better or more effective than, say, Ozempic or semaglutide. And so, how is this possible, and is it doing anything differently? And the answer is yes, it is doing something differently, but it's also doing something similarly. So this has a dual action. So not only is it as a GLP-1 agonist, it's also a GIP agonist. So in addition to being a GLP-1 agonist, it's also a GIP agonist. So insulinomic tropic polypeptide. So it has two different mechanisms of action. So like I previously said, semaglutide or Ozempic, these medicines, they only act on the GLP-1 receptor, whereas Mounjaro acts on two different receptors. It acts on the GLP-1 receptor and it also acts on the GIP receptor. So the GIP receptor is insulinotropic polypeptide. And so this actually enhances almost all the effects that GLP-1 has. So it enhances the body's insulin response and actually may improve fat metabolism. So what are the primary functions of GIP? So GIP can stimulate insulin secretion and it can also improve insulin sensitivity. So by doing this, it actually has all the mechanisms of action that I just discussed with the GLP-1s, and it also has these mechanisms of actions that are specific to GIPs. And so this is why Tirzepatide or Mounjaro is usually, or has been shown in several studies anyway, to provide more weight loss than say just semaglutide on its own. In addition to that, one other thing that GIP may do is that actually may be helpful for bone health, which is kind of interesting. So remember that GLP-1 agonists may have this unique mechanism of action where they may reduce cognitive decline and help with the neurodegeneration of certain neurodegenerative diseases. Well, GIP may have a role in bone metabolism, may in fact increase bone density, which is very, very interesting. And so because you're getting medicine that targets two different systems, you're getting a better overall effect. And so for Mounjaro, this has been approved for type 2 diabetes. It is expected to be approved for weight loss, but right now it is not approved for weight loss. It is just approved for type 1 diabetes. So again, the only one that's currently approved for weight loss is Wegovy or semaglutide. So right now, Mounjaro isn't, but we do think that it will be. In terms of the route of administration, this is injected, so there's no oral form of this as far as I know right now. Mounjaro is something that is only injected. And the starting dose of this is usually around 2.5 milligrams weekly, and then slowly can be increased, even all the way up to 15 milligrams or so. So again, with Tirzepatide, you are, or Mounjaro, you are going to get all the same benefits as from semaglutide, but they just will be enhanced. So, what have they shown in clinical trials? A lot of the same things. So reduced A1C or better blood sugar control overall. And because patients are getting better blood sugar control, this will lead sometimes to weight loss. And, they've had some studies that have shown that people have lost up to 52 pounds in 72 weeks. This is at a dose of 15 milligrams a week, so they were using a high dose in this trial. But 52 pounds in, just over a year, less than a year and a half. And so because of this, people are getting very interested in this medicine, again, because of the dual action. It seems to be more effective than Ozempic overall. Unfortunately, it does come with some of the same side effects or all the same side effects as GLP-1 agonists. So you're going to get the nausea, the diarrhea, constipation, vomiting, all these GI symptoms that people get. Again, this is usually just early on, and it's mostly when people use too aggressive doses. So, again, I really can't stress this enough, but if you are going to use this drug, start on the lowest dose possible and gradually, very, very gradually increase your dose if you need to. Again, pancreatitis is something that has come up with this medicine. Gallbladder issues, you may have an increased risk of gallstone. And again, the thyroid tumors in the animal studies as well. So we need to be careful about all these things when we're, thinking about taking these drugs. And I also should have mentioned that like semaglutide or Ozempic, this has been shown to reduce cardiovascular events. Again, it's going to be through reducing your hemoglobin A1C and improving your overall blood sugar control and reducing your waist circumference. So all these things will lead to better control. And one other use that it may have actually is on PCOS or polycystic ovarian syndrome. So researchers are suggesting that this may be an effective treatment for this. It's certainly not approved for it right now, but it is something that it may be approved for in the future. So this may have more applications than just weight loss and also diabetes patients. And so, what's my overall take on this? My take is that try not to get to a point where you need to use Ozempic or you need to use one of these weight loss drugs. Try to get to a point where, you can do this on your own just with diet and exercise. That would be my advice, number one, first and foremost. Number two, if you are going to use this, you definitely want to do it under the care of a physician. And like I said, you want to use the lowest dose possible and titrate up slowly. Okay, monitor yourself for side effects. Be very, very diligent about how it is reducing your overall cravings, And just understand that, when you come off of it, these cravings are going to come back, and be mindful of it. And if you are going to use this medicine, like I said, you are going to be at risk for muscle loss just because of the fact that you're probably going to put yourself in a caloric deficit from not eating so much. So because of that, what I want you to do is to strength train, optimize your hormones, and eat lots of protein. Those three things are really going to minimize all of your risks of losing muscle mass when using this drug. And as far as its effects on other things, can be very effective for diabetes, can be very effective for reducing overall cardiovascular risks. So, it is an interesting medicine. I'm not someone who has, really used this or prescribed this medicine a lot. Again, I really encourage my patients just to use plain old diet and exercise, to get lots of sleep, get lots of sunlight, socialize, all these things that just lead to better overall well-being and improved health. But I know that there are some people out there who really struggle. They just can't, for whatever reason, manage their cravings. And if you can't manage your cravings, I think that this medicine may be effective for you. But just know that when you stop this medicine, those cravings will come back, and you will have to use willpower and a very, very low dosing titration schedule, meaning you should back off on the dose very, very slowly, over weeks to months before you, before you take yourself off the medicine completely. So, guys, I really hope that you enjoyed this podcast today. If there's anything that I'd left out, I'd be happy to do another episode on Ozempic or on Mounjaro. And as always, I'll be back again soon.